The actual speaker. It's my duty and pleasure to, let me get up here, to introduce my friend and longtime colleague, Professor, newly minted Professor, Ernie Nelwan at the University of Indonesia Faculty of Medicine. She's the principal investigator of the trial you're about to hear about. And it's my pleasure to hand the mic and floor over to her.
Okay, thank you, Kevin, and hello, everyone. So we decided to share this lecture. I'm going to do the presentation, and he's going to be answering the question. So yeah, on behalf of my teams, I would like to present the vaccine trial in Indonesian soldiers. So this is the study using the attenuated malaria sporozoite that aim to see the safety, tolerability, immunogenicity, and also the vaccine efficacy against the natural infection in a highly endemic area in Indonesia. So I represented the University of Indonesia, and we have the collaborators from Sanaria as a sponsor, Indonesian Army, Green Eijkman Institute, and also Crew Indonesia, University of Oxford. So this study consists of 3 trial sites. All the regulatory and also the main office and main lab is located in the city of Indonesia, in the capital in Jakarta. But we have our site for the immunization in a malaria-free area in Sumatra Islands. This is the Rio province, when the battalion that will be deployed to Papua will be started from this province. And then after the immunization, they will be deployed to Papua province, where the malaria endemicity there is very high. It's more than 100 per thousand population. So this is really the time that we can see whether the vaccine is really works or not. So this study consists of 2 arms of vaccines. The first arm is the Plasmodium falciparum sporozoite vaccine. This is the attenuated by irradiation, consists of 9 times 2 times 5 sporozoite versus placebo. They've been given in one arms. And on the other arms, we are doing the head-to-head comparison between these 2 vaccines. The other arms is the fully infectious sporozoite that really sensitive to the chloroquine as the partner drug. So this parasite will be then controlled in vivo by this partner drug as a chloroquine. And we give only 2 times 10 to 5 sporozoite vaccine in these arms. So as you can see here, that we are divided the phase of the trial into 3 phases. First is the pre-exposure. This is the time where we do the immunization for the soldiers, and then we have 2 times for observation, the exposure time during deployment and the post-exposure time while the soldiers is returned to the home base in Sumatra Island. So as you can see here, that we really need to be able to secure the time that we finish all the vaccination process before they deploy to the Papua area, because the time where they deploy is not something that can be controlled by the study team, but this is really depend on the authority of the military. So we are now at the post-exposure phase, when the soldiers is already returned to the home base. So this is the clinical activities during screening time in Bangkinang. This is the name of the area in Rio province. We do screening, and also we put all the data, physical examination, and also the vaccination. This is the first vaccination that we conducted in the study, as you can see in the first picture. And then the teams in the red uniforms is the farm ops team that preparing the vaccine to be given to the soldiers. So then after that, the soldier will be then entry to the first follow-up period, while this is the exposure time for 9 months, and we collect all the malaria cases and also the blood sample collection. And then after they return to the home base, like I already mentioned, we continue the post-exposure follow-up to see the malaria cases detection and also treatment. So we also have the oversight of the study from the Indonesian FDA and also the internal and external monitoring without any major findings. So this study is really conducted well. So for those activities, we collected more than 11,000 blood film and blood sample, and we reported during the deployment phase 31 severe adverse events that not related to the vaccine trial, and all the participant is already fully recovered. And we also have all this ethics committee reporting, as you can see, two from University of Indonesia and military, and OSEC, HIPO, and also Indonesian FDA. And also during the clinical evaluation, we monitoring the participant every 2 weeks until the post-deployment phase. So this is the malaria case distribution. As you can see here that the first case of malaria falciparum and vivax occurred on the first 2 weeks while they arrived in Papua. This chart showed that within 450 days of observation, as we can see that the red line is represent the Plasmodium falciparum infection, that after the post-deployment, the number of infection is really just stagnant there. It's around 200 cases in total. But for the Plasmodium vivax infection, after the post-deployment, we get the number of more than 800 malaria infection, and as you can see here that the line is keep increasing for the malaria vivax infection. And for the complementary survival, it shows that the red line is the Plasmodium falciparum. So within the deployment time, around 300 days of observation, 60% of the participants is actually never had the infection of Plasmodium falciparum infection, while only 30% of them during the same phase is survived for the vivax infection. So all the malaria falciparum infection that occur in the deployment time, none is really referring to the hospital. So no severe case is actually happened. So this is what we found during the study. Of course, we face challenges. As you can see here that the study itself is actually already started from the MOUs in 2018, but then we have the restriction due to the COVID-19, and so we only can receive the approval from the ethics committee in 2022. Then we start to conduct the vaccination on June 2022. And then also the change of the head of the military that also make the approval of the study become more difficult. And there's also an overlapping between the official assignments of the soldiers to our visit schedule that make us need to make an improvement how we can still able to stick to our protocol. And then also there's many arrangements that cannot be controlled by our team, like for example the date they need to depart. So we should be able to make sure all the logistic permission and everything being set up before the date of the travel of the soldiers. Otherwise we cannot able to manage the vaccination like a schedule. And there's also one for us it's a very important stories that happened, that we are not able to receive our chloroquine drugs in time because of the technical issue that the world courier not able to send the drugs from the US to Indonesia. Therefore, the drugs should first fly to UK, while at Gibbs and Dr. Chris Cohn helped to receive the drugs, and Prof. Kevin by itself flew to the UK, brought the medicine right away to Jakarta, and then we send it to the site, so we are able to maintain to finish the vaccination in time before the army sent to Papua. And also, as you can see that it's really difficult area. This is this is my last slide. So you can see that the area of monitoring during the deployment is very difficult. So it's the road and also the unstable of signal. So it's really difficult for us to be able to get all the data properly due to protocol. But yeah, alhamdulillah, we managed to do it. I think this is my last slide. Thank you very much, and you can see how relief is from Kevin with the floor of you. Thank you.
Thank you, Annie. I think we have room for just one question. Any question from the audience? Yes, go ahead.
Why don't the army consider chemoprophylaxing their soldiers, given the hit rate is almost 100%?
You mean for the current practice? Well, yeah, that's a question because actually, I think they're more to the phase of the deployment. I mean, they will be staying in the highly endemic area quite for some times, even though they assigned for 9 months, but it can be longer than that. So they are not really have the regulation on providing prophylaxis as routine for the army. Is that the question? Yeah. So and besides that, we only have doxycycline at the moment from the national program for the prophylaxis. We are considering to have another drug, but due to the potential central side effect that not really maybe works for the soldiers, so they are worried. So we need the National Committee of Malaria. We need to decide to do first study and observation whether we can choose another prophylaxis test for the army. Thank you.